Okay, we got kinesiology 231, and this is a rundown of the case study 2, as a matter of fact, that is all about Mrs. Wilkinson. Now, Mrs. Wilkinson, 45-year-old female, leads a pretty stressful lifestyle with a small company, a couple kids, she's divorced, and with her data points, and you look at this, you have a mountain of information coming at you. And when I started to review some of the submissions, I have to say, I think some people are a little bit confused regarding positive and negative when it comes to risk factors. So I want to touch on that in this presentation. This table on 144, at least in my book 144, when you look at this, you have these 8 things up top that are positive risk factors, denoted in red, and then you have negative risk factor on the bottom. So this is kind of like your guiding light when you evaluate clients, at least for these labs, right? Because when you look at these case studies, these case studies are all going to focus around table 9.1, and you gotta have to wrap yourself around this concept. When it reads as a positive risk factor, that is to infer, and quite literally means, there is a positive relationship between age, family history, cigarette smoking, etc. As there is an increase in those, there is also an increase in the likelihood of cardiovascular disease. There is a positive correlation, a positive relationship between those, however you want to say it. The only negative risk factor you have is high density lipoprotein. So the higher that number is, the more it reduces the likelihood of cardiovascular disease. So you have to look at this, and it's not like saying yay positive, yay me. This is saying positive, meaning the older a person gets over a certain age, the greater likelihood of cardiovascular disease. If there is a greater amount of physical inactivity, put your fingers in quotes, and there's a finite amount of physical activity, right? If there's a greater amount of physical inactivity, the greater likelihood for cardiovascular disease. So that's almost like how you have to look at this chart, or table, excuse me, and apply it to any of these case studies. So let's go ahead and take this a little step further, right? Scrolling down, if I were to do this, and this is how I would break it down. We have our 8 main areas, and I would break them down as such. And I just took the paragraph and I parsed it out. She's 45-year-old white female. The white female part is inconsequential at this point, but she's under 55, so that's not a factor. Father suffered a coronary embolism at age 60. That's after age 55, so no, that's not a risk factor. She smokes 2 to 3 packs of cigarettes a day. Yeah, you bet that's a risk factor. Has little or no time to exercise, so she's physically inactive. So that is also a risk factor. 5'4", 120, BMI comes out to 20.6. That was one of your questions. So she's below 30. No, not a risk factor. Blood pressure, 158/92. Usually you see like in these write-ups that 130/80 is kind of the cutoff, but she would be classified as stage 2 hypertension, and you'll see this in a second. Her blood work revealed high density lipoprotein at 37. That's below 40. That should read as 60 right here. And also, her HDL is 140, which is above 130, so that's a yes. So to that end, and then you go into glucose, she's not over 100. So we look at those 8. Yeah, I updated that to 60 just so we don't get confused here. But it's still, her number is still below, whether it was 40 or 60, she's still below that number. So to that end, let's take this a little bit further. There's other data points in her write-up. Claims to drink X amount of alcohol, non-contributing factor. Her resting heart rate is 72. At this point, for what we're trying to evaluate here, that is a non-factor number. Her triglycerides, when you look at that, again, non-factor. She's an owner of a company, so she's a high-stress lifestyle. So look at this. From the book, you have the threshold of 45 for men, 55 for women. We know she's under 55, non-factor. Father suffered a coronary embolism at the age of 60, and if you read through this, a first-degree relative for a male before 55 would be a positive. He was at 60, so that's not a positive factor. She smokes 2 to 3 packs a day. Yeah, 100%, that's a positive factor. Has little or no time to exercise, but wants to do something. She's physically inactive, so that's a positive risk factor. Scroll this down further. BMI is this, below 30, and that tells us Nothing. That is not a positive factor. Her blood pressure 158/92. That's classified as stage 2 hypertension, and you'll see that in this chart down here. She's over the 140, she's over the 90, stage 2 hypertension. Make sure I got that right up there. Yes, stage 2. Come on down. Her blood work revealed low density lipoprotein 140, and the LDL is over 130, so that's a positive correlation. And then her glucose is at 91. It's not over 100, so that is not a positive. Okay, so we got some positives, got some positives in here, but we have no negatives. She's below the 60 as denoted. Man, I'm all over the place with that write-up. Okay, a little better at typing. So we know that that is not going to be an issue for her. Sorry, I got the icon down there for my screen grab right in the middle of that, but it's below 60, so that's not going to be a positive. So if we break this out and we look at it in terms of the algo for the American College of Sports Medicine, she does not exercise, so we're going to be over here to the left. Now this is the one I took it right from the ACSM article that I've provided before, and I provided the link down here because our book reads as it's the same on both sides, so it's confusing. So participates in regular exercise? No. So that's going to put her over here in this domain. So you can just get this right off the table. And though she does have positive factors, she doesn't present with signs or symptoms suggestive of cardiovascular, metabolic, or renal disease, right? And to that end, medical clearance is not necessary. And if we take this a little bit further, you can gradually progress to vigorous exercise. And this is per the ACSM guidelines. So let's take this down here just a smidge further. These are the breakouts that you have on the second part of the algo. And it describes and denotes some of the main domains. So like vigorous intensity, you can look that up. But here are your signs and symptoms. So at rest or activity, she doesn't describe pain or discomfort in chest, neck, jaw, arms, or other areas. And so to that end, you're not really seeing anything that denotes signs or symptoms. And so if we take this even a step further, this is your link out to the article that has the algo in it above here. So if we take this a step further, number 3 is a positive, she smokes. Number 4 is a positive, she does not exercise. Number 6 is a positive because she's hypertensive. 7 is a positive because she's above the 130. And then she is below the 60, and to that end, there is no positive, or I'm sorry, negative effect there for that person. So to that end, guys, you look at this and you go, okay, if you were to actually assign a point value, which you're going to see in your next lab, she would have 1 point, 2 point, 3 points, 4 points, and there's no takeaways, no takeaway points there. So, okay, she's got 4 points. But long story short, when you look at the signs or symptoms for CAD or pulmonary or metabolic disease, none are listed. And if we go ahead and go with the answers, risk stratification, low, medium, and high, I would probably put her at medium, and this question will probably be removed, and they'll see this somewhere else in another case study. So if you look at this for question 1, here's your areas that you have. You have 4 main risk factors. The next question where you want to list a negative risk factor, there isn't one, so that should be blank. And then you list the signs and symptoms for CAD and pulmonary and metabolic disease, none listed. Risk stratification, that'd be medium, again, as I mentioned. The client needs a medical exam or doctor clearance. This would be false because the algo provides that it does not need a medical exam to work out. The client needs a medical exam and or doctor clearance for vigorous exercise. True, but I'm going to remove this question because the long and short of it is the algo would direct you, the student, to the ACSM guidelines for exercise testing prescription. And you'll see that 9th edition, 2014. But I don't believe this question to be valid, and I didn't write this question to be quite honest. I don't think it aligns with some of the teaching that we've had in this class. We've not introduced the compartmentalized 3 strata, if you will, for people who might be at risk, not at risk, or moderate risk. So to that end, I'm looking at removing that question because I think that is not a valid question based off of what's been taught in the course so far. But down the road, in the next case study, you'll see an introduction to that. Other concerns. You might be able to lump stress into this, but she really doesn't have any skeletal or muscular concerns at this point. So there'd be nothing in here at this point unless you put stress as a concern. What is the calculated BMI? That's a pretty straightforward one. You just do the math on that. And according to the BMI result, what category? And that would be per the table in the book. That's pretty straightforward to find. And then what would be the blood pressure? And as we denoted above, that would be stage 2. So I hope this helps, guys, because I think we had some students who still have an issue regarding positive and negative, and it being a correlation to coronary artery disease, but not being like positive, yay, this is a good thing. I would definitely make it a point for the next case study, get acquainted with this, maybe save this address somewhere on your browser so you can reference it quickly, and you'll be able to access this fairly straight away. And the other part of it is we'll get into the risk stratification and point system in one of the next case studies for your client. So at the end of it, Miss Wilkinson, though she's stressed out, though she smokes, can start an exercise program, and you can feel confident taking through a program at a moderate pace. And I would presume you'll see her numbers actually moderate and come down, and I would presume you'll see some other qualitative components to her life in terms of stress, etc. But I think with somebody like Miss Wilkinson, you'll be fighting a fight where you're going to have to find time and advocate for her to carve out time for herself in her own life that is admittedly full of stress with 3 kids in a divorce situation, and also has a business of her own. And I would look at the key area to tackle would be the smoking, though I'm presuming she uses that as a prophylactic for stress and uses that to help moderate some stress situations. So to that end, guys, go ahead and take Miss Wilkinson through a nice workout. Don't crush her, and build her up and give her some good lifestyle management tips to help her going forward. Okay, hope this helps.